how AI has impacted on your daily duties. So how AI somehow changed your life, if it changed, and if you can tell us a little bit more about the AI specifically.
So yeah, that's a very good question. And we've been talking a lot about AI, but how has it actually affected our work right now? And just to say it out there that we are in a flux situation right now. And although I do believe that AI in healthcare is incredibly promising, not based on what I've sort of done in the past or some projects that we are working on right now. However, actually getting AI implemented in a manner that actually makes a difference on the ground, that always is a little slow to catch up when all of these processes and programs are being set up. However, just to share a few that I've worked with that has affected my day-to-day, let's say, practice in the hospital. One is, for example, EKGs, electrocardiogram. Now they are being read by a system and that has been trained, although not the best, and a good clinician actually never looks at that in deep, looks at those readings as much, maybe for calculating certain values on the EKG. However, to really interpret the EKG based on what the patient is experiencing, we don't look at the AI reads as such. Then, for example, echocardiogram, the ultrasounds for the heart. People don't know this, but a lot of measurements that a cardiologist or a physician looks at in those readings and reports, they are all AI generated. It will take a cardiologist or anybody else a long time to actually measure all those measurements and bring it for clinical use. Then what I've worked on in the past as well is sepsis alerts. So sepsis is a condition where you have an infection and it could become really deadly very soon. And if it is not picked up early enough and treated appropriately with the fluids and the antibiotics and everything else that needs to go in this management, if this is not picked up early enough in the hospital, the outcomes and mortalities can be extreme, and you need to prevent this. And this is one of the measurements by which a lot of hospitals are actually judged on. Sepsis alerts has been an actual use of AI, although I do believe most places don't do it really, really well, and there's loads of room for improvement in this because this is something that needs to improve further. Then, similar to this, there are warning systems and scores that assess that, okay, this patient is sicker and we need to pay more attention to this individual. For example, the Muse score, the modified early warning score. So this is how you judge whether the patient is sick, and maybe we need to move the patient to a higher level of care, perhaps, and provide better care for the patient. Like I mentioned, definitely numerous modalities are coming in. And for example, when I set up the COVID-19 monitoring unit, we had it set up that the doctors and the nursing staff won't get alerts every 2 seconds. Those alerts will need to be meaningful. They need to have a certain degree of assessment by the software that, okay, let's not bother the clinician, the nurse, with every single variable or finding or oxygen level or heart rate that may not be actually a thing to be alerted about. So these things, of course, all need to have utility that is real. We have to, of course, take into consideration that AI has a lot of potential. We may not see it as much right now in actual clinical practice, but loads and loads of things are coming into the picture, and we're going to see it very, 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 very soon. Yes. Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.